Hi, everyone. Good afternoon. Thanks so much for joining today. I'm going to give folks another minute or two to join, and then we can go ahead and get started. And while you're joining, if you could go ahead and put in the chat your name and organization, or if you're not affiliated with an organization, just what brings you here to this training today, and um, why you feel passionately about vaccines. Awesome. Thanks. Good to see you, Melissa. Thanks for joining. Great. All right. Well, I'll continue to admit people as they join, but just to be aware of the time, I will go ahead and get us started. So thank you all for joining today. This is our third delivery of the Immunize Virginia Vaccine Champions training. And we're really excited. We have some returning speakers today as well as a new speaker. So we are very excited to be able to have this conversation during a very timely moment in vaccine policy. So to give you all some background in case you're not familiar with Immunize Virginia, we are the state's immunization coalition, and our mission is to protect the health and advance the well-being of all Virginians by optimizing immunization rates. We do this through, professional and community education, as well as advocacy work that you'll learn more about in this presentation. And we have some photos here from our annual meeting this past May. We had the panel up top talking about the Virginia Immunization Information System, and the importance of funding that. And then we also had the State Health Commissioner, Dr. Cameron Webb, join us to deliver the welcome remarks, which was very exciting. So, um, just a little bit of background about Immunize Virginia. If you have any questions or want to learn more, feel free to contact me. And I should introduce myself. I'm Belle Kelly Russo, and I'm the Associate Program Manager for Immunize Virginia. And this Immunize Virginia is a project of the Institute for Public Health Innovation, which is the logo you'll see on my Zoom screen. All right. Just to go over the agenda quickly, we will be hearing from Dr. Stuart Hanakowitz, who is our advocacy work group chair, and he'll be doing an Advocacy 101 primer on the basics of advocacy versus lobbying, and also specifically in Virginia, what that process looks like and how to research the different bills going on in General Assembly and things of that nature. And then we'll be hearing from Izzy Brandstetter Figueroa, and we're so excited to have her join us. She's from Unbiased Science, which is a podcast that helps to bolster science communications. And I've been a longtime fan of them, so definitely glad to have her joining today. And she'll be talking about how to combat anti-vaccine legislation specifically, and going over some of the recent policy changes that have happened at both the federal and the state level recently. We'll then have just a 5-minute bio break, and then the last 30 minutes, I'll be going through a training on how to write effectively for vaccine advocacy. So, learning about the difference between a letter to the editor versus an op-ed versus a press release, and best practices for crafting those messages. So, without further ado, I will turn it over now to Stuart.
Hello. How are you all doing? My name is Stuart Hanakowitz. I'm a physician who has been involved in health policy for a number of years, and I'm the chair of the advocacy work group. I'm going to start with a little anecdote this morning. It's like reminds me of things that I say that that turn out to bite me, and that is, I saw the New York Knicks game last night. I don't know if you're all aware. There's a basketball, the NBA basketball finals, and they're playing the San Antonio Spurs, and I'm from New York, and so well, it's all very exciting. And the Knicks were losing by 27 points in the first half, and I told my wife, yeah, I'm not going to stay up for this. And lo and behold, this morning I look at my New York Times app and they won. So I missed the one of the greatest comebacks ever in sports. So, what lesson have we learned from that? Well, for me, is a certain one lesson, but I think the lesson for us is that never give up, and I think that especially now with advocacy, and we're having a difficult time with advocacy, is just keep at it and stay for the rest of the game. That's I've always said that, but sometimes you just don't do it and you pay the price. So anyway, end of anecdote. Now, um, advocacy work group um, that we offer opportunities for learning about different advocacy issues, public awareness campaigns, and proclamations. We had a difficult time in the last number of years with the uh, proclamation for National Immunization Awareness Month, which we actually were able to get into law this year, which was great. And Bell has and the folks at Immunize Virginia have done a lot of work with that. We we look at various pieces of legislation that they come through, and it's interesting. Very few have come through in the last year. Um, Part of advocacy, being in an advocacy work group, is just being there and learning and seeing how things are done and how the process goes. Um, and affords you an opportunity for direct advocacy and/or lobbying. I mean, lobbying, especially just going through the halls of the state legislature and talking to legislators and legislative aides and seeing how the process goes on. I think it's very useful exercise and it's a good learning experience. Next slide, somewhere. There we go. Why does advocacy matter? Because otherwise, nothing that you're interested in gets done. You have to promote your policies. Things don't happen on their own. People who are passionate about something and amplify their voice about something, they get things done. Otherwise, no one will know what your priorities are. So it's always helpful to be amplify voices in the community and try to influence policies and practices, always done in a respectful way. And this matters both within and without the organization. So it's a little bit different if you're part of a large organization and you're advocating for changes in that organization. So that's different than going out into the community, into the state, into the national arena, and trying to address problems. Now, obviously, we deal with vaccines, and so that's what we're focused on. But this can be uh, generalized to and other kinds of issues. Next slide. So, in terms of looking for advocacy, look at what communities you care about. And like everything, like a lot of things in life, it's all about focus. What issues are more urgent? What do you think it will impact the most people? And in politics, you have to sometimes go for the win. And that means you have to have the ability to compromise, to get part of what you want across. Wait for another time, fight another day. but try to pick off the easy wins. It's um, helpful for the advocacy community. It shows that things are happening. But you also have to learn about who's in charge, right? Where the room in which the decisions are made, right? So who has the authority to influence change and actions you feel comfortable taking to improve conditions to your community. Obviously, with vaccines, if you're a vaccine advocate, it's pretty straightforward, um, even at the state and national level. But at any rate, we can go through some of that. And if you have questions, obviously, I can go through that. So, civic engagement, right? Participating in activities to improve quality of life. How can I make things better? Trying to find out also, and I think this is something that we do in Immunize Virginia, is what does the community interested in? What problems does the community have? What can we, how can we serve our different coalition partners? And so I think that's very important is to do that kind of reach out, that engagement, and see um, who, what motivates people, what interests people, what problems people have, and and then follow up with that. Next slide. Okay, so there are a variety of activities that you can do with civic engagement. There are either political activities or non-political activities, and I think that's important for a group such as ours, which is to use the legal jargon of 501c3 organizations, a nonprofit organization. I hope I'm not saying something that's not true, Bell, right? Okay. So, we are not supposed to be lobbying as part of a 501c3 organization. Um, but there are other organizations where you can do political activities, voting, canvassing, petitioning, lobbying. So I lobbied for the Virginia Association of Free and Charitable Clinics a number of months ago. I volunteered at the Arlington Free Clinic, and so we walked and we lobbied, and we were asking for increased funding for the clinics. So that was a lobbying activity. But voting, canvassing, door to door that I've been seeing the last few days uh, it- where I live, and petitioning, the right to petition. It's in the First Amendment. You remember the First Amendment, don't you all? So some people don't remember it quite as well. But anyway, um, in government, not in this. Not where we are. But there are non-political activities as well, volunteering, mentoring, donating to charity, and organizing community events, which are things that I do, for example, with the free clinic. I mean, I do pretty much all of those things. And except for, not as much in organizing community events, but doing other things. And I think mentoring is so important. I think part of what we do is uh, to do, but to teach, so that others can follow and others can uh, take on their responsibilities. Next slide, please. There you go. So, how do we want to engage? Um, uh, Getting involved. Again, this just kind of refers to different sorts of things. But education, advocacy are things that we can do with Immunize Virginia, and which we do. We're doing that today, for example, and volunteer opportunities, um, protests, letter writing, all of that. I think it's pretty much in our purview to do many things except for political things and lobbying things. Where these are things that are, again, 501c3 organizations, which are tax exempt organizations, are not charitable organizations, are not um, or have they're not supposed to do these kinds of efforts. We do all these sorts of machinations. For example, I work with the American College of Physicians, which is a 501c3 organization, but they have a lobbying arm, which is a different tech organization. So we stop doing one thing and we start doing another. But with Immunize Virginia, we're pretty much mainly funded by the Virginia Department of Health, which is an arm of the state government. So that's another reason why we don't get involved in lobbying. But it's always better to engage in a group. There's power in numbers. There's power in getting people together, organizing community events. You never know when a younger person can get that spark to get motivated to do things. And so education is very important. Um, I think that there's just somewhat of a distinction between non-political and political activity, but really a lot of what we do is it can be thought of as political. From a legal standpoint, we don't want to be political, but we certainly want to educate and show what problems there are. Next slide. So, what is advocacy and what is lobbying? So, advocacy would be um, teaching folks about the issues that are involved. For example, I don't know if you were looking at the news recently about the American Diabetes Association and physicians who were handing out um, copies of their editorials from the Diabetes Care magazine. That's an example of advocacy, okay, which they apparently were not able to do. If you're handing out flyers, informational leaflets, and so on, and you're raising awareness in your community, that's advocacy. Lobbying is specific. It's something that's specific that you do to influence government decisions. So you support for a bill, talking about pro or con for a particular piece of legislation, asking for a vote pro or against. Next slide. So lobbying is a subtype of advocacy, but again, it's for specific legislation, and that's what we do when not Immunize Virginia, but other organizations go to lobbying day, and we go and speak to our representatives, and we ask them uh, uh, specifically for a bill, to bills that we find important, and in terms of vaccine policy. Um, there's not very much that we've been doing, but there is something that will come up in the next legislative session, we hope, that will help to uh, make it easier for people to get vaccinated according to the recommendations of our major health organizations. Next slide. Okay, here's a quiz. Activity. Can you tell the difference? Meeting with a representative to educating them about the importance of investing in maternal health. And where everyone's muted, so I'll just say it. So that's going to be advocacy, right? So next, meeting with a representative to urge them to vote for a bill to provide extra funding. That's going to be lobbying. Um, Oh, someone said lobbying. Thank you, Newly. Thank you so much. Creating educational materials that show success stories from your programs. That's again going to be advocacy. So next. Is that next? Oh, preparing materials that include information and contain language for or against specific legislation, and that's the key. So that's going to be lobbying. Posting stats about diabetes and stories about programs. What are CHW programs? I'm so sorry.
Community health workers.
Community health worker programs. Thank you, that are helping to reduce. See, I'm still befuddled from the game yesterday. I'm sorry. So community health worker programs are helping to reduce diabetes rate. Again, that's advocacy. So that kind of gives you an idea. Something that's specifically about legislation is going to be about lobbying. Next slide. So issues to advocate for, we talk about big P policies, which involve community and public things outside of your organization, and little p policies, which are organizational issues. And that's always it can actually be even more difficult to advocate for because you work there and it's difficult to do. But big P policies are what we do when we advocate for vaccines. Little p policies might involve what we do at the organizational level when we have our meetings and we think through, well, what kind of changes do we want to make? Do we have enough equity in our policies? What sort of leaders do we want? Um, do we want to get more people into leadership positions? Those are little p policies and organizational issues. Next slide. And little p information you can find in your employee handbook, um, and if you have a large enough organization, you find policies that are within your organization, uh, which includes a strategic plan, board of directors, policy, and standards of conduct. But the advocating a little p is sometimes a minefield, and you can um, what is it? Familiarity breeds contempt. I don't know that it does that all the time, but you're able to, sometimes it's a difficult slog. Some organizations are open and there's free discourse. Some are not. But still, it's important to learn to advocate within the confines of what your organization is. Next slide. Oh, and so this is the slide that is, well, my schoolhouse rock slide. So how a bill becomes a law. You all are too young for that, are you? Still? No, not too young. Okay. So bill is drafted and introduced, reviewed in committees. So this is how in Virginia, right? The vote. You have to understand that the bill is introduced both in the House of Delegates and also in the state Senate. So they're reviewed in committee, they vote, and then things switch over, and then the there's the House bill and a Senate bill. If there are differences in the House bill and the Senate bill, that gets it goes through a reconciliation process, and then you have an executive approval. So either the governor signs the bill or vetoes the bill. And the other thing about this big P information is that, if you lose, and a lot of people do, they come back and change things a little bit to see if the political climate has changed. And after a while, that bill does become law. Next slide. And the LIS is something that I've used for many years, and it's a wonderful system. It's online, and it tells you everything you need to know. All the bills and resolutions, all when they were introduced, who's sponsoring them, who's co-sponsoring them, when is it going before the committee, you know, uh, all the information that you need in searchable databases. So, and it goes year by year. You could find out what happened 10 years ago. So, really, if you're involved in lobbying efforts at the state level, the LIS is essential, and it just makes things easy. And I don't know if we have more. Oh, so understand policy impact. So, well, in terms of a particular policy, you want to know um, policy, for example, for with regards to state Medicaid, right? Who is involved in creating the policy? What is the How does the policy impact if you're going to be lobbying for greater Medicaid funding, for example? Okay, so for expanded Medicaid benefits, who will it impact, right? Your constituents, the positive impacts, negative impacts. Why would anyone be against that? Because there are budgetary constraints. So people who will argue about that. Is the impact temporary? Will it change over time? Well, with Medicaid, for example, that would be a year by year appropriation. When it comes to lobbying, most of what it comes down to is the money and how things are appropriated. Um, and then you think of how to make things successful, unsuccessful. You try to negotiate, you try to make things easier for some legislators to swallow. Some will, like, for example, with Medicaid expansion, which we do ha have in Virginia, but we cover up to 133% of the federal poverty limit, and but we didn't in the past, and so you have to kind of get information about a person, about a district, about how their constituents feel, and so on. So, and the impact that it will have is great. Okay, is that my that's my last slide. So, if anyone has any questions, um, do try if you belong to other organizations, go on the Hill, get there, and do lobbying. You'll learn a lot, and you'll learn about how government runs, and participate with us as well in terms of vaccine policy. Anyway, any questions we'll have for later. Belle, thank you very much, and thank you all for your time.
Thank you
Appreciate it.
so much, Stuart. That's really helpful. Thanks for sharing that. And I will say, Immunize Virginia, you're correct, cannot lobby, but we do have, if you go to our website, we have a lot of materials that we've developed that you can take with you on your lobbying day with another organization. We have a new toolkit that has the MMR kindergarten vaccination rates by district and actually broken down by elementary school as well. So that's a helpful tool to have when you're meeting with your legislator. All right, and
Perfect.
I will now turn it over to Izzy. Um, and yes, and just let me know when to advance the slides.
Perfect. You can go ahead and go to the first slide. So I'm super appreciative to have the opportunity to talk today. I work at Unbiased Science, and so much like Stuart's been alluding to, we're not in this space where we generally focus on advocacy. We try to focus just on the science and give people the materials that they can use to be advocates in their own communities. Obviously, I think it's a little hard to talk about the science without talking about politics and policy in our current climate. And so that line has blurred a little bit, obviously, but trying to stick to the science here. I also just wanted to highlight that I co-write a vaccine policy brief every 2 weeks, and this is in partnership with CIDRAP, which is the Center for Infectious Disease Research and Policy at the University of Minnesota. I think I have a link or a slide later that shows that, but that's a great place. We kind of just do a roundup of all the different things happening in the world as vaccine policy is constantly changing at the national level and then behind the scenes, obviously, at the state level as well. And I also just want to do a little plug here. So, my work in the vaccine promotion space started at Immunize Washington. And so, this is a really nice full circle moment, and I'm really happy to be here. Next slide, please. So before we go into some of the more specific policy things, I just want to talk about how we got to where we are now. So we live in this gap where there's clearly, we know, time and time again, we've said that vaccines are safe and effective. And that hasn't changed. If anything, I would actually argue that we have more evidence to suggest that. But simply saying that vaccines save lives it's not cutting it anymore. It's not enough. We live in this information ecosystem here where we have the scientific elements over on the left, but we have this gap here between the public perception because people are getting their information from different sources. The COVID pandemic certainly magnified this trust gap here, and so we have this new gap where we have to figure out a way to bridge it. And unfortunately, or fortunately, this gap is being used. This is where all of these policies really thrive, both at the state and the federal level, is bringing that gap together. And whether they're using it for good or evil is kind of up for debate. I'll leave it there. Next slide, please. So I just want to quickly go through, I'm sure all of you know this, but the FDA requires 3 phases of clinical trials in order to ensure that vaccines are safe and effective. And these are before they're used in the broader scale. So I have a few extra phases here, but starting, they evaluate the safety. So this is phase 1. Phase 2 is efficacy. So how well does it do in the target population? And this is looking for side effects. Then we go on to phase 3, where we're looking to see how a vaccine performs against what we have right now. So this might be a placebo if it's a brand new vaccine, but more often than not, it's something comparing to a treatment or an existing vaccine we already have. And then it's after these that the FDA can make a decision about whether they want to license the vaccine. So that's kind of the data gathering phase. And then phase 4 is all of the stuff that happens after a vaccine is licensed. So we don't just stop studying the vaccine it gets after it receives its licensure from the FDA. So this is going to be all of the real world effectiveness things. So how well does the vaccine perform in terms of how real people interact with each other, in terms of how real diseases interact with each other? Next slide, please. So I'm going to try not to go too deep into this, but I think it's really important. We've had quite the whirlwind in the past 6, 7 months with federal vaccine policy. And we know that these federal changes have all sorts of ramifications, including vaccine funding and access. The kind of rotating carousel of leadership is not necessarily helping with that. It's actually making it even more difficult to trust people. And so the states have this huge role here to be ready to adapt and advocate to these federal policy changes along the way. The biggest example I can come up with here, and I'll talk about this specific to Virginia in a moment, but we've seen in light of the ACIP changes that occurred back in January, lots of states, including Virginia, have really stepped up and kind of worked to decouple their vaccine policies from the CDC or ACIP. So to give other options for these medical organizations and their policies to kind of be the leading force. Next slide, please. So, in this kind of that gap that I showed you on the last slide, we have different kind of angles of anti-vaccine legislation that are constantly at play. And I like how Stuart shared, even if a policy loses in the prior year or 2 years prior, there's always going to be this gap here, and they're waiting to see until the climate is favorable for them to reintroduce that bill and keep pushing it forward. And that can go on both sides of the political spectrum. So it's not just anti-vaccine, but pro as well. So we've seen just a vast increase in state level bills all across the country. A lot of these have focused on exemptions, so religious exemptions, expanding religious exemptions, as well as removing. Um, one of the greatest examples, I think, today, or in the past couple of days, I'll get to this in a sec, but Arizona actually has their big medical freedom bill moving forward right now, as of yesterday, I think, and it's going to the governor's desk. So that's something that's like that could be really changing. Um, and I also just want to throw in here, working in this space and hearing all of this anti-vaccine legislation constantly, it's so easy to fall into the trap of thinking that this is popular opinion or common. And I really, really want to emphasize here that it's this anti-vaccine legislation, it really is the minority of people across the country and within states. So just because they're very, very vocal, does not mean that they are the majority here. It means they're putting in the work because they're kind of, going against the status quo of what we currently have. Next slide, please. I think I already touched on this, so I think we can go to the next slide. So this is just a broad overview of things that have happened since January 2026. And January 2026, of course, is what I alluded to when the vaccine legislation, so when the ACIP tried to remove a bunch of vaccines from the vaccine schedule. So that was back in January. In February of this year, the Virginia Department of Health aligned with the American Academy of Pediatrics and American Academy of Family Physicians schedules. And so this is what I talked about earlier with decoupling from the CDC. So they're allowed to make their recommendations based on those guidelines. And that matters for insurance purposes, for school recommendations, etc. So that's a really, really important piece of legislation. Then on March 4th, Virginia joined the Northeast Public Health Collaborative, and this is just yet another step to bring together some of the states that are like-minded in this field so that to promote and advocate for scientifically and evidence-based health. So then we had on March 16th the stay that was issued on the American Academy of Pediatrics versus Kennedy. And so this essentially put on hold any of the changes that occurred in January and reverted back to the back to the 2025 schedule. So anything that got removed from the schedule is currently on hold, essentially. This also basically made the ACIP ineligible. So that means there's nobody that is actually on the committee right now that can legally provide recommendations at this time. So there's a little more that happened in the background. We've seen in the past a little over a month or so, the ACIP actually renewed their charter, and then they withdrew it and put in a new one again in May. And so this seems to be something where we're seeing that they might try to put new people on the committee, but that things to work kind of the back doors while the AAP Kennedy decision irons out. And then, as you probably saw a couple of weeks ago, President Trump had an executive order around vaccines, and this was basically another thing to realign the US childhood vaccine schedule with best practices from peer developed countries. And this is really almost a copy and paste from what happened in January, but under a new political angle of the executive order. Next slide, please. All right, so these are specific to what happened this year in Virginia. So there's actually, thankfully, only one negative bill introduced, and that's the Hep B, the House Bill 983. And so that sought to remove Hep B from the list of school required immunizations. Um, Immunization Awareness Month was designated in August of 2026. So that's the second one there. There was a budget amendment that occurred, and this ensures the childhood immunization schedule will be funded. And finally, um, this is really an offensive strategy, and so this has been um, looking at ways to expand the Vaccines for Children program at the state level. Next slide, please. Okay, so these are a couple different plugs. This is the policy briefs that I write every 2 weeks. If you're interested, and I can send the link out. So a lot of this content is actually going to be in the issue that comes out today. Next slide, please. So this is another resource I just wanted to share with all of you, and this is from the folks at the Common Health Coalition. Stuart, did a great job sharing the searchable database, the LIS system. And this is one that I find, as somebody who's not maybe quite as policy, like I don't need as much of the weeds for what I do. This is a really, really great resource. It's a large spreadsheet where you can see all of the different types of actions that are occurring, which vaccines are impacted, and it's just a really nice summary of where you can plug in and help. Next slide, please. So with all of this being said, just knowing that all of these policy changes are happening in the background it's not enough anymore. We need to be active, we need to be proactive. And I just wanted to share a couple examples of where this has been particularly meaningful over the past couple of years. So this is first a case study in California. So there was a really large measles outbreak at Disneyland, as some of you may remember. And this kind of happened in the backdrop of California had medical exemptions, but it wasn't necessarily, it just was something where they had never said no medical exemptions. And so in light of um, the Disneyland measles outbreak, they actually introduced State Bill 277, and that went into effect shortly, like 2016-ish, I believe. And that removed non-medical exemptions, which was huge. So it made it harder for people to not get vaccinated. And we saw after that coverage for the MMR vaccine rose from 91% to 96%. And this was a huge, huge success for the advocacy space. So that really made all the difference there. Next slide. So this is another case study in South Dakota. So 6 different anti-vaccine bills were introduced in 2024. And it was because of the coordinated advocacy between all of these different groups that all of those failed. So there's a lot of different, I think lawmakers are busy people, right? And so they rely on people's advocacy to help ensure that the communities stay safe. All right, next slide. So I think I've talked about this a lot now, but we're in this space where it's I mean, it honestly feels like there's a lightning strike every time I look out the window. It seems like there's always, some catastrophic vaccine policy happening. And so it's really easy to fall into this pattern of just being reactive to what's going on. Um, but with kind of the state legislatures around the country winding down, and particularly in Virginia, I think it's really easy to fall back into that pattern that, well, they're not active and so nothing's going on. But we really, really, really need to be proactive here in this space. And that, again, as Stuart said, if things fail one year, there's nothing stopping them from coming back in future years. And we kind of know the playbook by now of what the different levers are that can be pulled. And so we really need to start building the relationships with the community and our legislature now, before before the lightning strikes, I'll say. So one thing that we focus on a lot at Unbiased Science, and just something that's really helpful now, as we move into this new space of scientific communication, is sharing stories. So the old way of kind of data dumping a bunch of statistics, I'm an epidemiologist, so I love numbers, I love stats, but that's not what's moving people anymore. It's really the personal stories, the things that stick with people, the things that people remember, um, that are important in this space. So, a lot of these advocacy groups can share kind of high level bullet points of different topics to cover, but your ability to personalize them in whatever form that means for you is so, so, so crucial. Um, and then I think just it's really hard to stay respectful and persistent in this space. There's no doubt that there's a ton of burnout, and that some of these policies can just be so frustrating you want to rip your hair out. But um, you know, coming from a place of empathy and respect and understanding that, believe it or not, I truly believe that a lot of people advocating for these other sides of the legislation are coming from the right place. They're trying to do the best for their communities. And so really trying to keep that level of empathy in mind when you're communicating, just being respectful makes you so much more heard ultimately. Next slide. Okay. So I just want to go through a couple of different options here, and of ways that you can be involved. So you don't have to do it all, right? There's different ways that you can slot in based on your skill set and your availability. You can contact your legislators, sorry. You can testify at hearings, even things more locally where you're just building community and awareness at school boards or community forums. You can write op-eds or letters to local or state papers. And then there's also the advocacy days that you can be a part of. But really, I just want to emphasize here that there's a space for everyone, and it really, your skill set is important and valued, and there's different places that you can slot in. Next slide. I think I already mostly covered this, but just to say that there's different toolkits available, as well as Immunize Virginia, has messaging available. So you don't have to do the heavy lift of figuring out what your talking points are. You just have to use those in a way that's personal and meaningful. All right. And this is just kind of a recap of what I already said, but really just to say that, staying informed is huge, and there's changes happening constantly, but there's ways to kind of understand how it's happening in a distilled way so that you're not overwhelmed. And really, even when it feels like the off season, building these relationships and using your own voice is so important so that when something does happen, you have the infrastructure in place to be able to act. And I think that's all I got.
Thank you so much, Izzy. We really appreciate it. This is a slide left over from Mike Martin. This is his closing message when when he presents of the little engine that could. Um, so we have a few minutes. I was hoping if anyone has questions, we could go ahead and ask our two speakers before we change topics and talk more about the outreach part of this. So feel free to come off of mute or just put your question in the chat.
I just wanted to say that Izzy's organization is the best, and CIDRAP is incredibly important. And Dr. Michael Osterholm has been a great leader in vaccine coordination, in vaccine policy coordination, and really is the model for where we go. So incredibly important work, Izzy, and so thank you.
Thank you.
Great. All right. Are there any questions from anyone?
And I'll just add, sorry, I forgot to say this earlier. I'll just add this too that the Vaccine Integrity Project, which is part of CIDRAP, has been um, a fantastic resource. And so this is almost a group that's been sort of filling the role that the CDC and the ACIP have had previously in terms of reviewing evidence and updating evidence as it comes out. So that's another resource within CIDRAP that I can share the link to somewhere so that it's here for folks.
Amazing. Thank you. Great. All right. Well, I will just keep us going then, unless anyone wants a break. But I think I'll just go through my slides and then we can maybe end early. Um, So I'm going to be talking today about, how to share those personal stories, and how to effectively reach lawmakers, reach community members, and try to fill that gap that Izzy was talking about in terms of the public perception and really combating some of the misinformation that's circulating these days. So, to start, I'll just say, why is this important? Why is this worth your time to do? And it's really because people in, the present day, they rely on what people they perceive to be like them are saying and doing. And so, we've seen with social media, there's, an increase of people trusting strangers even if they feel aligned in terms of their outlooks on the world. And we are sorry, there's a siren going by right when I start talking. Um, Sorry about that. Yeah, so we're trying to, you know, set those social norms and remind people that it really is a majority of folks who believe in vaccinating themselves and their children. Um, it's hard when there's a vocal minority, but when you look at the percentage of people in public opinion polls, there still is a large majority of people who are in favor of vaccination and want to have, routine access to vaccines. So the ability to, share our points of view and to get the public conversation going, um, it really just strengthens that public trust. And it's also just a very low lift in terms of resources. Anyone with access to an email account can do this. So today I'm going to walk through some of the steps and best practices for how to craft your message and how to share it. And if at any point you have questions, just feel free to interrupt. So, as I just mentioned today, we will, talk about the different opportunities to write letters to the editor versus op-eds, and then how we can craft compelling and concise messages. Um, we'll then talk about how to increase the likelihood of these messages being published, and then how to align messaging with groups like Immunize Virginia, the state AAP chapter, the American Association of Pediatrics, the American College of Obstetrics and Gynecology. There are all of these different professional organizations right now who are being very vocal about their commitment to evidence-based science. And there is strength in having those messages being unified and showing that we are all standing together. So just to break down some of these different terms, because I think they get tossed around sometimes interchangeably, but a letter to the editor is when you are responding to something that has already been said. So oftentimes, it's if you want to join a public conversation in a newspaper, to show that you care about an issue. It can be in agreement with the original author, it can be in disagreement, but it's just kind of, like I said, carrying on that public conversation, versus an op-ed, which is an opinion that you are introducing. So it's a topic or a perspective that hasn't yet been covered by that news outlet, and you are just seeking to start the conversation. Um, there's also a press release, which is a little bit more tailored to an organization rather than an individual. But the idea behind that is if you want journalists to cover your news, rather than express a personal opinion. So an example of that is this past January, Immunize Virginia released our first statewide immunization plan, called the Virginia Immunization Plan, or the VIP. And we released, we submitted a press release, so that we could have interviews with local radio and news stations. So why these forms of media work? You're really targeting your outreach. So you're reaching local people. Um, the importance of organizing is that the more local you can make it, the more it's going to resonate with with others. Um, and policymakers pay attention to what their constituents are saying. So they have, even if the policymaker themselves isn't reading the newspaper every day, they have a team of people who are going through and scanning the op-eds and seeing, what are people saying? What are people thinking right now? It's also helpful just to be able to shape that media narrative. So, we think about the New York Times and the Washington Post, but there are so many other smaller media outlets that are carrying on these conversations. And just by the nature of even bringing up the topic of vaccines, that could help to shape someone's opinions. And like I said before, you're just demonstrating community support or concern. So if you're having conversations with your neighbors, your friends, family, um, and you feel strongly and you recognize that others feel strongly, um, that would be the perfect impetus to be able to share your opinion on this. And then, of course, also just sharing personal stories. So, one op-ed that I wrote a few years ago was sharing my personal experience with losing my dad to cancer and thinking about all of the people who are, cancer survivors or people undergoing chemotherapy who are immunocompromised and who, would benefit from community immunity or herd immunity. And so I think just being able to be, vulnerable with my story and my experience really resonated because I think pretty much every person I know has had, has been touched by cancer in some way. So the more personalized you can make that story, I would say the better. So a lot of it is timing. Um, right now we are, like Izzy said and Stuart said, we are in a timeline of rapid change. It really feels like every day there's another bombshell announcement. But because of this, vaccines have been more covered in the news, and I think there's increased opportunity to be able to submit information or uh, writing like this. Um, there's also, not to, um, it's a delicate balance in terms of responding to local outbreaks because you always want to lead with sympathy for the families who are affected. You never want to have it seem like you're, um, trivializing their experiences or using it as a launch pad for your organization's agenda. But it can be very timely and powerful to be able to share these messages during local outbreaks because it's at the top of people's minds. In Virginia right now, we have a measles outbreak. The last time I checked, it was 106 cases, but it might have gone up today. And this is a really significant aberration from previous years, previous decades. During my lifetime, we've never had a measles outbreak like this, and so part of our communication strategy right now as an organization is, how do we let people know that we exist as an organization, that we have resources that are helpful, and how can we point them to information such as the new dashboard that the Virginia Department of Health created? How do we let them know about these resources and make sure, people's questions are answered? Um, there's also, I'll talk later about this, but National Immunization Awareness Month. So Izzy mentioned that there was a joint resolution in the General Assembly this year, and that was a really big win in that every August from here on out, there will be an automatic recognition of Immunization Awareness Month in Virginia. Previously, we had to, as private citizens, we had to petition the governor. And during certain administrations, it was approved and others not. So this will be, I think, a great point of, just reflection each August to be able to have an increase in media opportunities, and especially during the back to school rush of, parents getting their children vaccinated. And then also, just responding to misinformation, acknowledging that, misinformation as well as disinformation. So disinformation being false information that's spread intentionally. There's a lot of that circulating, and there are very specific ways in which you can address that false information. There's science communicators like Izzy are the experts on this when it comes to, how do you address misinformation without repeating the falsehood? There's a lot of thought that goes into that, but um, really just being able to share the true information and lead with the truth is, I think, the most important thing that you can do. In terms of writing tips, I would say as much as possible, keep it brief. Um, be specific and hyper local. Um, use plain language that the average person would know. I think as scientists and, medical professionals, even within public health, there's a lot of jargon, and it's best to not use that terminology because that can feel exclusionary. Um, if possible, it's good to be positive and solution oriented, to motivate others, and also just including your name, um, and where you're located helps to personalize the story and build that trust of, okay, this is actually another human being. Um, The structure is pretty simple, but in terms of the um, sorry, not the op-ed, but the letter to the editor. So you would reference the article that you're responding to, or if it's an op-ed, you'll just reference the issue at hand. And then, you always want to have evidence in there. But as Izzy mentioned, data doesn't always move people. And so it's best to kind of do a data sandwich, I would say, like start with your personal stance, what's at stake for you or for someone or for just a group of people, like I mentioned, people who are immunocompromised. And then, have that evidence, have that stat, cite where that comes from, and then, again, close with some of the more personalized information. And then at the very end, it's important to have a clear call to action and some kind of message to mobilize people. Um, so really, in terms of the messaging, Immunize Virginia tries to really lead with community protection. So, why is vaccination important? It's important because it's a getting vaccinated is a way to say you care about the well-being of other people, whether that be your neighbors, your family. It's a way to not only protect yourself, but to protect others. Um, there's, that messaging of health for all, that's kind of at the core of public health. Why I feel so passionately about vaccination is that in this action of vaccinating yourself, you're doing something that's a common good. And as I mentioned, you want as much as possible to avoid repeating the misinformation and just focus on facts that are true. So some phrases that people have used before are that, vaccines are one of the most effective ways to keep our community healthy. And some evidence to speak to that could be the number of dollars saved in terms of reduced healthcare spending based on vaccination, or the number of lives saved. Um, and those stats exist. Two websites that have really good resources on that are Vaccinate Your Family, and then, as Izzy mentioned, the Unbiased Science is another great one, as well as CIDRAP. And then also being able to say, like, as a parent, a teacher, a nurse, I've seen how vaccines protect us firsthand. Here you go. So in terms of getting your story published, it's best to start local. And, you want to make sure that your submission is qualifying. You don't want to exceed their word limit. And you want to know their process for submitting. Um, the timing of it does matter. So if it's a letter to the editor, you want there to be a pretty quick turnaround. So within 24 to 48 hours after you see that story run. Um, that way you're keeping the conversation going in a timely manner. Um, if it's unpublished, it's okay to follow up politely and ask why. Um, you can also share your writing with, you know, this says on the slide, it says published, but as well as unpublished. If you've written something and it doesn't get picked up, we are happy to share that to our social media. We have a blog that we run, and we also have partners like Voices for Vaccines, which is an organization dedicated to sharing people's experiences with vaccination. So um, there are always other ways should your material not get picked up and published officially. And here I've linked, let's see if this will open. And there might actually be a paywall for this, but this is an example from 2 years ago. Um, Are you all still able to see my screen? Let's see. Okay. Sorry, I just wanted to make sure I was in presentation mode. Okay. Um, so that example is from Bethany Hammond, who is a public health nurse in Roanoke. And she wrote that letter to the editor um, in conjunction with Immunize Virginia. So just some closing messages. If you don't remember anything else, these four words help to encapsulate the key takeaways. So timeliness, making sure that you are either responding directly to a recent message or considering the ongoing events in your community. Clarity, so being concise and using words that are easy to understand, trying to stick to kind of like a high school literacy level. Credibility, so, that could be if you are, a professional nurse or any kind of um, if you have professional involvement, but also if you have just any kind of personal experience. And then finally, community voice. So if you're able to demonstrate that there are other people who feel this way, and that could be through storytelling or it could be through, acknowledging there was a poll done of healthcare providers in Virginia, and this many said they felt confident in the safety of vaccines, for example, which is a survey that we did of healthcare providers a few years ago. And then here I have linked a majority of the outlets, media outlets in Virginia. Um, so if you would like my assistance in reaching out, I'm happy to do that. Um, I can also just send this um, in our follow-up so that you have these email addresses and phone numbers so that you can get in touch. But I'm also, I'm happy if at any point if you're in the very early stages of drafting it and you want some help with the writing, I'm happy to help with that. I'm really happy to help in any way that you might need. So um, I will close us out there. Um, and I will say, we have our advocacy work group that meets monthly. So if anything you've heard today was, motivating you to take further action, we would love to have you join. It is a closed group meeting, so you would have to email me to get the Teams link, but we would love to have you. You don't have to have any prior experience with advocacy. We're just looking for people who are passionate about the topic and would like to take action.